But many ophthalmologists around me have had surgery done by me, so if you're planning to get Smile LASIK, then getting it from me. Hello, I'm Director Han from Eye Clinic Siblings. The new year of 2025 has begun, wishing everyone only good things all year long. Today, I'd like to talk about one of the most popular surgeries, Smile LASIK. Are you ready? Let's get started. Vision correction surgery refers to procedures that correct refractive errors like myopia, astigmatism, and hyperopia. It is largely divided into laser vision correction and lens implantation. Laser vision correction includes LASEK, LASIK, and Smile. Let me first explain the principle behind laser vision correction. People with myopia usually wear concave lens glasses to focus light properly. The diopter power of concave lenses is indicated with a minus sign. But our cornea has a convex lens shape with approximately plus 43 diopters of power. Laser vision correction works by flattening the cornea, which has a convex shape with a laser, so if someone wears minus 3 diopter glasses, their cornea is adjusted to plus 40 diopters, allowing them to focus without glasses. The procedure removes part of the corneal stroma, which makes up most of the cornea. The stroma is covered by epithelial cells, and how those cells are handled to expose the stroma determines whether the surgery is LASIK, LASIK, or Smile. Some of you may wonder, why don't eye doctors get the surgery themselves? Aren't you wearing glasses too? I can see well even without my glasses. If you only have mild myopia or astigmatism, there's really no need for surgery. Not everyone who wears glasses has bad vision, but many ophthalmologists around me have had surgery done by me. And I probably don't have to explain why they chose me. Let me start by explaining LASEK. So LASEK removes the corneal epithelium to expose the stroma, and then a laser is used to reshape the cornea. That's how the vision is corrected. Because the epithelium is removed, it causes some pain since that outer layer is peeled off. So recovery takes a bit longer, which is a downside. But a major advantage is that because it reshapes only the surface layer, more of the corneal thickness remains compared to LASIK. LASIK was developed to overcome the severe pain and slow recovery of LASEK. In LASIK, both the corneal epithelium and stroma are cut together to create a flap, which is then lifted. Then, an excimer laser is used to reshape the stromal layer. After making the correction, the flap is then placed back. However, because this process involves nerve damage, LASIK can make eyes more vulnerable to dryness. But compared to LASIK, the pain is definitely milder, and vision recovery is much faster. Next is Smile LASIK. Many people refer to it as Smile LASIK. But the correct name is just Smile, which stands for Small Incision Lenticule Extraction, removing a lenticule through a minimal corneal incision. The laser penetrates the cornea. It removes the precise amount of stromal tissue, and the lenticule is extracted through a tiny 2 mm incision to correct the vision. One advantage of Smile is that it's suitable for a wider range of patients. The surgery is quick and virtually painless, allowing patients to return to daily life as early as the next day, making it a great choice for busy professionals and students. The downside of Smile is that it tends to be more expensive. The equipment used is much more expensive than for other procedures. Also, the device used to fix the eye during surgery requires costly disposable parts, which raises the overall cost. But because the procedure offers so many benefits, even with a higher cost, many people still prefer it, and again, I probably don't need to explain why they choose me. Smile has fewer side effects compared to other vision correction surgeries, though dry eyes are still a common one. Dry eye can persist for several weeks or even months after surgery. But with consistent care, it gradually improves. Also, swelling of the cornea or dryness can cause glare and halos. To prevent dry eyes and glare, it's very important to use prescribed eye drops and artificial tears regularly. LASIK and LASEK heavily rely on the equipment used. It's all about the machines. But for SMILE, the surgeon's experience and technique matter much more. Medically, a nomogram refers to the surgical settings, like laser intensity and position tailored to the patient's eye, and experienced surgeons accumulate more data over time. So outcomes can vary depending on the surgeon. One important note, SMILE requires a femtosecond laser device called VisuMax from Zeiss in Germany. Some clinics falsely label surgeries as SMILE even when using imitation devices. Though they claim it's the same, the laser algorithms are different and outcomes are not yet proven for those devices. So if you're planning to get SMILE, make sure the clinic has the actual VisuMax system. So, we've taken a look at SMILE LASIK. I hope I didn't overly focus only on the positives of SMILE LASIK. It took me 5 hours to film this video. If this was helpful, please like the video. And don't forget to subscribe. If you have any questions, leave a comment. We, the Eye Clinic siblings, will answer sincerely. We'll be back next time with even more useful info. This has been Director Han from Eye Clinic Siblings.